Good evening, everyone. My name is Ria Suarez with the Cancer Support Community. Thank you so much for joining tonight's webinar. This is the fourth episode of our webinar series. It's called Frankly Speaking About Cancer, Coping with Hormone Therapy Side Effects. This webinar is hosted by the Cancer Support Community and sponsored by Amgen, Astellas, Lilly, and Tesaro. So just some housekeeping items and some reminders. Today's webinar is being recorded and will be made available on our website at cancersupportcommunity.org/webinars. For this webinar, our speakers will be presenting first, and then we'll have some time for a Q&A session at the end. If you'd like to ask a question, you can do so by submitting it through the question and answer box, which is found on the right of your screen. You may submit a question at any time throughout this presentation. At the end of the webinar, you will be redirected to our post-webinar survey. We ask that you please complete this survey as your input is of great value to us. The survey will only take a few minutes. So just some background on the Cancer Support Community. We are a professionally led nonprofit organization that provides social and emotional support to all people impacted by cancer. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. This slide lists some of the resources and services that we have available. We have our Open to Options program, which is a research-proven program that can help you prepare a list of questions to share with your doctor. You can speak with one of our specialists who will help you create this list of specific questions and concerns that you can then bring to your doctor during your appointment. We also have our Frankly Speaking About Cancer education series that provides information on a variety of topics that are important to people affected by cancer. This webinar is part of our Frankly Speaking About Cancer series, but we also have print and digital publications, online information, and in-person workshops. Also, programs like this webinar were developed in response to feedback that we received from others impacted by cancer. If you find this program to be valuable or you have input on other programs or services that you would be interested in, a great place to share these thoughts and other experiences that you've had throughout your cancer journey is by joining our Cancer Experience Registry. Our registry is a community of people touched by cancer and is a place that helps you make sense of your cancer experience. So if you'd like to join our registry or learn more about any of the programs that you see listed here, feel free to call our Cancer Support Helpline, which is listed at the top of this screen at 888-793-9355. I'd also like to introduce our grassroots movement, which helps ensure that people touched by cancer have access to quality comprehensive cancer care, which includes social and emotional support. Again, if you'd like to join this grassroots movement or have any questions about it or would like to learn more, please visit our website at cancersupportcommunity.org. It's now my pleasure to introduce our featured speakers for today's event, Barbara Lubejko, Colleen Gill, Steve Musser, and Sharon Risberg. Barbara is an oncology clinical specialist in the education department at the Oncology Nursing Society. She has been an oncology nurse for over 30 years in clinical research and educational roles. At ONS, she develops educational programs and clinical resources for nurses and has a particular interest in evaluating how these programs and resources can help nurses provide the best care for their patients. Barb has also cared for several family members who have received treatment for cancer, including her mother, father, and sister. Colleen is a registered dietitian-nutritionist, speaker, and author, working with oncology patients since 1990 at the University of Colorado and since 2001 in her private practice, Nutrition Foundation. Colleen is active in the oncology practice group of the Academy of Nutrition and Dietetics. She helped write the first certification exam for dietitians in 2008 and is herself a board-certified specialist in oncology. Steve is currently serving as the District Superintendent of the Eastern District of the Evangelical Free Church of America. Before taking on his district responsibilities, Steve served as Senior Associate Pastor. He also was Professor of Management, Director of the Center for Leadership Development at Messiah College, and a corporate consultant. He holds a bachelor's degree from Albright College and a master's and PhD from Temple University. His seminary training was done at Evangelical Theological Seminary. Sharon has a master's degree in education. She has been an educator for 39 years. Sharon changed careers at the age of 50 and now works for a company that reproduces conference and webinar materials online for the purpose of continuing education. She also instructs an aqua cardio fitness class at a local club. Sharon has been married for 40 years and has 2 sons and a daughter, and now 4 grandsons. Outside of work, she spends time with her family and participates in as many outdoor activities as possible. She enjoys kayaking, gardening, bicycling, woodworking, and games. I would now like to turn the presentation over to Barbara.
Thanks, Ria. I have to tell you guys before we get started that dealing with a topic as big as hormone therapy for cancer really opens up a lot of kind of boxes about different types of side effects. So I'm not going to spend a whole lot of time about why hormone therapy is given, because I think that there are so many bigger issues to talk about with this. But hormone therapy is used specifically to treat cancers that are hormone sensitive, and they work by decreasing the amount of specific sex hormones in the body. And by that mechanism, these medications work to prevent slow progression or prevent recurrence of specific types of cancer. And they can work either by reducing the amount of the specific hormone in the body, in particular how much is made by the body, or to reduce the cancer cell's ability to respond to the hormone. There are many different medications that are used for this purpose, all designed to achieve the same outcome. In addition, in the past, surgical removal of organs such as the ovaries and the testes were done to try and produce the same effect. But with all the medications, that's really just not happening much anymore, unless women in particular have specific risk factors, such as genetic abnormalities. So the types of cancer that are most common treated with hormone therapy include for prostate cancer for men. And the main sex hormone for men that is targeted is testosterone, because this is known to reduce the amount of, because testosterone is known to stimulate the production of the cancer. For women, the main hormone that is suppressed got to get my head together here, is the main types of cancer that are treated with hormone therapy are breast cancer, ovarian cancer, and endometrial cancer, and the main hormone that is suppressed is estrogen, but also sometimes progestins may be suppressed as well for a similar reason. There's a lot of interaction between the levels of the different sex hormones, so sometimes you'll suppress one to try and get another one to increase or vice versa. So in terms of side effects of hormone therapy, there really are a lot of different side effects that happen, and I wanted to focus on the ones that are most closely related to hormone therapy specifically. Some of the big ones that people will encounter are hot flashes, both for men and women. We'll talk about that. Changes in sexual function as well as decrease in desire. Gynecomastia for men who receive testosterone suppression, memory problems, bone loss, sleep disturbances, fatigue, all of these things can happen because of hormone therapy, and many of these things then will contribute to body image changes, which can really make some of these other problems even greater. To start out with, I wanted to talk a little bit in general because for so many of these different complications, not just of hormone therapy, but of any cancer therapy, there are two main interventions that can be very beneficial, one of which is physical activity. And if any of you have been on the previous webinars, which I highly recommend, not just because Colleen and I did a good job, but because I think they've got great information, it's physical activity. And physical activity will help manage so many different side effects and make people feel better. It can help strengthen bones and reduce fatigue, which are some of the big side effects of hormone therapy. It can improve sleep. It can help with memory. And it can also help with body image by being fitter. And when we talk about physical activity in general to help with some of these side effects, what we're really talking about for most people is moderate intensity walking. A lot of different options are out there, but the one that's been studied the most is walking. And typically what we're talking about is 30 minutes, 3 to 5 times a week, as you can tolerate it. And this kind of type of physical activity can be helpful at any point from diagnosis through survivorship. And in addition, for most people, moderate intensity walking has minimal risk. So it really can be very beneficial. However, other types of physical activity can be very helpful as well. Strength training has been shown to help manage a lot of the side effects of cancer therapy, including hormone therapy. And also things like flexibility or balance training like Tai Chi or yoga can be very helpful as well. And what's really recommended is to try a little bit of everything. So do some aerobics, do some strength training, do some flexibility or balance training, depending upon what your specific needs are. In addition, stress reduction can be hugely beneficial. And again, stress reduction can help with things like hot flashes. It can help with memory difficulties. It can help with fatigue and and sleep disturbances. And there are many options for stress reduction, and it really is a matter of finding what works best for you. Things like mindfulness meditation, which is all about kind of being in the moment, seeing how you're feeling in the moment and dealing with those feelings, both physical and emotional. Yoga can be very helpful in many ways. Healing touch has been beneficial for some people. Expressive writing, mind-body spirit therapy, like in Qigong, relaxation techniques, guided imagery. It's not clear from the research that's been done to date what's most effective. So it's mostly about helping you find what is most beneficial and enjoyable to you. So hot flashes. Can't talk about hormone therapy without talking about hot flashes, because hot flashes are very common among men and women who receive hormone therapy. Women definitely have these more often, but I can tell you my father got treated for prostate cancer and received anti-androgen therapy, and boy, did he have hot flashes. He was very sympathetic to my mother, who'd had them earlier in life. Hot flashes, also called hot flushes or night sweats, are episodes where a person feels intensely hot and may start sweating, feeling anxious, and sense that their heart is beating faster than normal. And these symptoms are sometimes followed by chills, and they can be very, for different people, they can happen very frequently. Other people have them less frequently. Sometimes they're very severe. Sometimes they're relatively mild. But for many people who are on hormone therapy, because it's an abrupt change in the level of sex hormones in their body, the hot flashes can come on very fast and very strong. So they can be really bothersome. So in terms of things that you can do related to hot flashes, before I get that. So the other thing about hot flashes is it's not just a fact of being uncomfortable, and I'm sure any of you who've had hot flashes know that not only are you uncomfortable, but it can interfere with your ability to sleep, which can lead to fatigue. It can decrease your ability to focus on everyday activities. So hot flashes are a real big quality of life issue. So some things you can do for hot flashes. Big thing is environmental control. Many people know that it's about the whole, dressing, undressing thing. Dressing in layers that can be removed or easily put back on. Cotton clothing and bedding are often helpful because they're so breathable and will help evaporate some of the sweat if you do, especially if things like night sweats. Reusable cooling bandanas that can be tied around the neck can be helpful. You see those advertised on some of the infomercials with some of the athletes, I think, that can't remember if it's Serena or Sister Williams who advertises those. Those can be very helpful. The other thing that will often help is just strategically place electric fans, having the fan where you can turn it on and turn it off, so that when you get hot, you can turn it on, and then when you cool off, you can turn it off so you don't get too chilled. Another thing that's very helpful, if any of you smoke or tell people or know people who smoke, stopping smoking can really reduce hot flashes because of the stimulatory impact of smoking and use really of any tobacco products on your body. Taking away that stimulus can help reduce hot flashes. We talked about stress reduction techniques, but they can be particularly helpful with managing hot flashes and have been shown to decrease the frequency in which they can happen. And then there are some medications that have been tried for hot flashes. Each of these will work better for different people. One that's been used a good bit, and there's evidence that it may be beneficial, is gabapentin, which is actually an anti-seizure drug, but has been used to some degree to help with hot flashes. Some antidepressants can decrease the frequency of hot flashes as well. There are a number of different medications that have been tried, but none of them have been shown to be effective for everybody. So it's kind of a matter of trial and error to find the one that's going to be most effective for an individual. One thing that is not recommended is hormone replacement therapy, because the whole idea behind hormone therapy for breast cancer and prostate cancer and endometrial and ovarian cancer is to suppress the effect of the hormones on the body. So replacing the hormones is not a good idea. And then there are some complementary therapies that have been tried, but most of them, again, the research is lacking. Some of these hormone therapies you have to be very careful with, because what they actually are is they are a different type of estrogen or testosterone, and by taking them, you may actually be having the opposite effect that you want. So you want to, before you start on any complementary therapies, you want to make sure that you talk to your healthcare provider to make sure that there's nothing in it that's going to interfere with the treatment. Another big side effect of a lot of these hormone therapies will be the loss of sexual desire. Because sex hormones are so important for sexual function, for things like developing libido, there are many people who do have a loss of sexual desire when they're undergoing treatment for cancer. And in addition to that, many of the treatments, because of the side effects they cause, because of the fatigue and the difficulty sleeping and the stress, and then the changes in body image can very much impact, for both men and women, sexual desire. And we know that sexuality is more than sex. It really relates to all aspects of connecting and communicating. So we're not just talking about actual sexual intercourse here. We're talking about that relationship that can be most important. And there are a number of things that can be done to help rebuild a romantic relationship with a partner, especially when you get through the most intense part of treatment. And one model that you can see on the side has to do with going kind of step by step through reestablishing that relationship. One is the whole need to establish emotional intimacy. One thing that can happen when people undergo therapy is their partner often is their caregiver. And so the caregiving role is almost more like a parenting role, which is not really very conducive to emotional intimacy. So it's important to think about that relationship and move toward that. There are some people who talk about things like 5 hugs a day, just try and start having that physical comfort again that's connecting in a different way. Touch is very important and can convey love and acceptance, and sometimes better than words. Another one is going from intrusive to pleasurable touch. Anybody who has undergone treatment for cancer knows that much of what happens during the treatment cycle, especially by your healthcare providers, but even caregivers at home, is related to healthcare problems. So it may be giving medication, helping with things like bathing. And what you want to do is move away from that, especially as you get into survivorship and more towards pleasurable touch and finding ways just to be comfortable together. Hand massages are actually a pretty non-invasive way to help with reestablish pleasurable touch. Another one is body rejection. Many people don't feel very good about themselves, so finding ways that you feel better about yourself and improve your self-esteem and relax. being comfortable in yourself, doing some self-affirmation has been suggested as a way to help improve self-esteem and relaxation, and learning to be comfortable with yourself again. And then slowly, when you're ready, reintroducing eroticism into your relationship. Other groups have talked about a desire diary, where you start to pay attention to the times of day and episodes when you actually want to have some intimacy with your partner again. And then not being afraid to discuss with your partner any fears you may have about returning to a sexual relationship. And I highly suggest that if you do have problems and are having trouble overcoming them with your partner, to ask to be referred to a counselor. There are all kinds of folks out there who work specifically with people who have undergone a diagnosis and treatment for cancer and are at any point in the survivorship trajectory, who can really help you work through how to become more intimate again. In addition to that, there are definitely changes in sexual function that both men and women can have. For men, this is primarily having trouble maintaining an erection, and erectile dysfunction is very common, especially during the initial portion of treatment for prostate cancer. But it's not necessarily, for many men, it's something that normal function will return to. So if you're having issues, first step is definitely to talk to your healthcare team about what the issue is in terms of maintaining an erection or other issues. And so there are a number of things that may help with this. One is intermittent androgen therapy, especially for men who are on long-term anti-androgen therapy. The healthcare provider may make the choice to give it intermittently, meaning, you take it for a while and then you take some time off and take it again for a while. That's shown to be, for many people, just as effective as doing it continuously, and may also help some with erectile dysfunction. There are other more typical kind of things that can be used to deal with erectile dysfunction, which are a little bit, or for any man who's got erectile dysfunction. So things like oral medications like Viagra and Cialis are okay to use, obviously under the counseling of your healthcare provider. There are vacuum devices that can be obtained, and there also are penile suppositories or injections. If a man has trouble with erectile dysfunction, best bet is to work with a urologist to try and help explore what different options will be, and also a sexual health clinic or counselor can help. For women, a lot of the problem with sexual function has to do with kind of typical menopausal symptoms, such as vaginal dryness or painful intercourse, both of which can happen as a consequence of decreased estrogen production or the ability of estrogen to do its normal job. Women who have painful intercourse, typically this happens because there can be decreased vaginal elasticity and pliability, decreased lubrication, and then that can be worsened by anxiety and fear of that pain. So a number of things can be very helpful. One is the consistent use of moisturizers and lubricants. They are two different things. Moisturizers are used on a periodic basis. A lot of times that's 2 or 3 times a week to help keep the vaginal tissue moist. And also lubricants that are more used when you're ready to actually have intercourse to help make it easier to have penetration without the pain. People have found that Kegel exercises, pelvic floor rehabilitation, can be helpful for some folks just in terms of maintaining some elasticity and pliability. Allowing sufficient time for foreplay and relaxation. Back rubs can be helpful for anybody in that situation, just to get you to relax and have some intimate touch. And then especially for women who've had radiation therapy with some of the GYN cancers, vaginal dilators can be very important as well. And again, just if you're looking at things like moisturizers and lubricants, make sure you're very careful about anything that says it's for women who are undergoing menopause, or who have menopause and have some of these issues, because some of them do have hormonal type products in them. Gynecomastia is something that can happen with men who are undergoing anti-androgen or anti-testosterone therapy. And gynecomastia is not just an increase in the size of the breast, but also tenderness. Actually can be very uncomfortable for some people. And this happens when the balance of testosterone and estrogen is altered. And what happens when you suppress testosterone, men do make estrogen as well, it tends to go up. and this leads to the growth of breast tissue. There are some treatment options. Tamoxifen can be given. That's the anti-estrogen that some of you may be familiar with. Can be given to help suppress estrogen while men are receiving anti-androgen therapy. It's usually best if it's given before the gynecomastia starts, but at the earliest sign of gynecomastia, if it can be started, it can help prevent some of the progression of it. Radiation therapy can also be helpful, but usually that needs to be given before gynecomastia occurs, so it's not something that happens a lot, and it's best if it's for just a small amount of gynecomastia. But for men who do have a lot of gynecomastia because of the anti-androgen therapy, liposuction may be an option, and for some, they need some partial skin removal as well. Memory problems. Memory problems definitely happen for a lot of people who have hormonal therapy, and especially in addition to other types of therapy. This primarily has to do with difficulty focusing and then retaining, and exhibits itself as, usually little things like forgetting where your keys are, forgetting numbers, forgetting names, having trouble keeping track of everything that's going on. There are some things that can be done to help with memory problems. We talked about exercise and relaxation already. Those actually can be very helpful. Cognitive training is one that has strongest evidence, and this is really, it's both memory and speed of processing training. If any of you have tried some of the online options that are offered, that's the kind of thing that they're talking about, is trying to train your brain to be able to keep track of patterns and specific details a little bit better. This has been shown to be very helpful to some people. The problem is that I can't recommend one specific type of cognitive training because the evidence is not out there. But if you're interested in trying something, most of the reputable ones that are available online could be helpful. Another is cognitive behavioral interventions, and this has to do with helping people to identify helpful and unhelpful behaviors that can interfere with their ability to cope, really. And with cognitive behavioral therapies, it's about being aware of what your concerns are and what you're having trouble focusing on, establishing goals for what you want to improve, developing problem-solving skills, and implementing new behaviors to facilitate effective coping. This can be done, both cognitive training and cognitive behavioral interventions can be done either as groups or individuals. And so if you're interested in something like this, talking to your healthcare provider, perhaps asking them to refer you to a psychosocial health provider might be beneficial as well. There also is some research that's been done on use of stimulants to help with memory problems, things like methylphenidate, which is Ritalin, those types of drugs. Modafinil as well is another stimulant. There is some evidence that it's helpful. So if you're having problems, memory problems, talking to your physicians about that may be one option as well. Another one that's very interesting is there is some research that shows exposure to being in the natural environment, being out in the natural environment, can be helpful with something that's called attentional fatigue, which is similar to memory problems. And in the research that was done, trying to be outside for 120 minutes per week out in the natural environment can be helpful for some people. So definitely something that would be worth trying. That also gets you exposed to sunshine, which can be helpful with things like depression and fatigue. So it's a relatively simple thing to try and do. One thing I do want to say is that for memory problems, ginkgo biloba is not found to be helpful, so that's probably something to stay away from, but just something to know about. Other types of alternative therapies have been tried as well, but there's really no evidence for them. Slowing bone loss, if I'm going to just go through this real quickly because we did the three webinars we did already. One of them was all about bone loss. I highly encourage you to check that out. The big thing about slowing bone loss is know if you've lost bone density. If you're taking these drugs, talk to your physician or other healthcare provider to have them test you to make sure that you're not losing bone density and moving toward osteoporosis. Main things that are going to happen, they're going to be our physical activity again. They do recommend moderate to high impact but other types of those kinds of activities can be helpful as well. Muscle strengthening can help in balance and posture, like we talked about earlier. Again, stopping smoking. I have read some literature that experts feel like smoking is as damaging to your bones as it is to your lungs. And I wish they would let more people know, so hopefully more people would quit smoking, but definitely don't smoke. Dietary improvements, I'm sure Colleen will address, limiting alcohol intake. And then there are a number of medications that can be used. I'm not going to go into these right now, but just know there are some medications that your healthcare providers might recommend if you have problems with osteoporosis. And then being careful to avoid falls, because once your bones get brittle, it's much harder for them to recover. Fatigue is another very common side effect, and we did have a whole webinar on that as well that I highly recommend. Fatigue can range anywhere from mild to severe, is very connected to a lot of the other side effects you can get with hormone therapy. Obviously, if you're not sleeping well, if it's being interrupted by hot flashes, you're going to have more fatigue. Again, physical activity. Physical activity has been shown to decrease fatigue. And what you want is at least 150 minutes of moderate intensity, or if you're up for it, 75 minutes of vigorous intensity each week. And you also want to throw in some resistance training and some stretching, and all of that will be very helpful for your body in terms of dealing with the fatigue. Sleeping as well as you can, we'll talk about in a minute, and stress reduction we've already talked about. And last but not least, sleep disturbances. Again, very common problem with hormone therapy, and for really anybody undergoing treatment for cancer, can be related to hot flashes and menopausal symptoms. Anybody who's got hot flashes that cause them to wake up during the night. I know people have very severe hot flashes where they have to get up and change their clothes at night. That's clearly going to make it hard to get a good night's sleep. Stress and anxiety, all that stuff going around in your head is going to be an issue. And then if you also have other sleeping problems, like if you already had insomnia or you've got restless leg syndrome or sleep apnea, those things are going to contribute as well. Again, things to do, physical activity, stress reduction. Can't say that enough. And then medications may also be an option. The choice is going to depend upon the type of sleep problem you have, and the goal is going to be to try and help overcome what your specific sleep problem is, but not make you more sleepy during the day so you have trouble functioning. For other things that you can do, there are lots of strategies that are under the category of cognitive behavioral strategies that can help with sleep disturbances as well, some of which we've talked about, some of them that are kind of new. One is that you want to go to bed and get up at the same time every day so your body gets cued in to when it's time to go to sleep and when it's time to wake up, and avoid daytime napping and minimize the length of naps, even if you feel like you need to have one. Only going to bed when you're sleepy. Don't get in bed and toss and turn and get frustrated. That just makes it worse. Get up if you're not sleepy and return only when you're sleepy. And use the bedroom for sex and sleep only, so that you're not laying in bed thinking about all the other things that you might do. Avoid caffeine in the evening. Maintain a comfortable sleep environment. A lot of people like to use light covers or covers that can come off and on, especially if you're having hot flashes. This can be an issue in a fan. Ceiling fans can be wonderful, or floor fans aimed at you can be wonderful as well. And don't watch television or use a computer screen in your bedroom, because that, again, can be distracting when you're trying to sleep. Also, cognitive restructuring, I alluded to before. That's identifying and changing negative thoughts, which really means if you're scared you're not going to be able to sleep and you're spending a lot of time laying in bed upset because you can't sleep, that's going to make it even harder for you to fall asleep. So there are techniques that can be used to work on that. And, again, relaxation techniques, and setting aside time before you go to bed to relax, maybe reading, listening to music, taking a warm bath or shower, whatever helps you relax, and then helps you kind of distract your mind from the things that have been bothering you during the day. That can help. There actually is research that shows that listening to soothing music, like I can't think of anything, soothing music, whatever kind of music you find relaxing, can be helpful for better sleep as well. And now I will hand it over to Colleen and be glad to answer your questions later.
Thanks, Barbara. I certainly agree with everything you've said, and we'll try to reinforce that as we go through these slides. One of my sister actually sent me, when I was going through menopause myself, some information on the 7 dwarfs of menopause, which are itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho, because you do feel like you've sort of become a new person, or your old calm self is gone. And it can change. It's really related to the change in hormone levels, but it's a bit of a domino effect of all these different side effects that are related to that, especially the hot flashes. And one thing patients have told me is that every time they have a hot flash, it seems like it's a reminder of their cancer diagnosis and of the treatments that they're undergoing, and it creates more stress for them in that fight or flight kind of hormones that can get released. And those, unfortunately, have absolutely the wrong impact on everything we're trying to control, both from a nutrition standpoint and cancer risk, but also from just hot flash control. So, Barbara covered very well the issues around altered sleep and weight gain and fatigue and memory and mood and depression. And I'm not really going to hit on those very much because we did cover them in those prior seminars that you can listen to online. And I didn't want to take up extra time going through that and try to concentrate more on some of the newer information today. So we're going to review some of the things you can do and simplify that direction for you by using the plate model really as what we are attempting to do, and kind of simplifying your the whole goals for you. Those of you who have heard me speak before realize that I try to turn everything back to the plate model, and it always seems to fit in, meaning that if we're looking at the surface of the plate, and this was originally developed by the American Institute of Cancer Research, who focuses on nutrition and physical activity, and highly recommend their website, aicr.org. But the plate model says that if you're covering the surface of your plate, about half of it should be, at the bottom of the slide, the fruit, about a fist-sized piece of fruit, all the vegetables you want. Beans, I actually put there, red beans, pinto beans, black beans, that sort of thing. They provide the phytochemicals and fiber that help impact estrogen management, which we'll talk about down the road. And about a quarter of it then is carbohydrate sources, and we're going to talk about how stable blood sugars are really important in this whole picture, and a quarter of it being your protein/fat sources that usually come with protein. And we'll specifically talk about soy and flaxseed and some of the controversies around that and around phytoestrogens, and then the usual recommendations of limited red or processed meats, more fish for healthier fats, and more evidence is coming out both in breast and prostate cancer that there needs to be low-fat dairy and probably not an excess of that. And in prostate cancer, they're limiting 2 eggs a week for various reasons, not necessarily tied to the hot flashes. On top of that, of course, sitting next to your plate would be what you're drinking. And we know that cold drinks help to cool core temperatures, and hot temperatures usually work against us in that way. So drinking cooler things is going to be something in your favor. Some of the nutrition issues that can actually aggravate your hot flashes and other symptoms are some things you can try to be aware of and control and avoid. Many people will say that if they sit down to a large meal, holidays are coming up and are good examples of that, especially if it's hot food, hot temperatures of food, that will tend to trigger more hot flashes in them, along with certain foods like alcohol, caffeine-containing foods, spicy foods. And I'm going to go through those specifically because alcohol has so many issues related to it that contribute to symptoms of hormone imbalance. And one of them is just the fact that it is a trigger food and it can trigger that hot flash for you. The other is that it provides significant calories if you're drinking very much of it. We're going to talk about the whole issues of weight and hot flashes and how they feed each other. And then, of course, sleep, although it seems to help you go to sleep, it actually contributes to pretty low quality of sleep. And it also is known to be dose related to estrogen levels, meaning for every basically drink of alcohol you might have, and they're listed down here, it increases estrogen about 7.5%. If you double that, it's up about 10.7%. So we're working really hard to suppress estrogen levels so that we can prevent that stimulation of breast cancers, and this is working against that. Caffeine is increasing cortisol, which is a hormone that tends to increase our anxiety, definitely interferes with sleep issues. So another reason to avoid the caffeine, especially at night, but it can trigger hot flashes significantly. And hot and spicy foods, we think the major player is that it affects that temperature regulation problem we already have, where the body thinks it's hotter than it is and is trying to release heat through the skin to cool that body down. And so staying with foods that you're staying away from foods that you might like in situations where you don't want to have hot flashes is probably a good precaution. We do talk about avoiding excess red or processed meats, excess dairy, because of the issues around increased inflammation, and that can certainly affect some of the arthritis and joint pains that accompany the change in our hormone levels that many people also are very disturbed by. They feel like they're getting, older than their years in terms of how their joints are feeling. And refined carbohydrates that increase insulin resistance, we're going to be discussing how we get into a vicious cycle with having more carbohydrate and having more difficulty handling that carbohydrate and clearing that carbohydrate, which can tend to increase your body's messages to store that extra calories away as abdominal fat, which unfortunately worsens your insulin resistance. So again, we'll be discussing that a little bit in more depth here. So if we talk about weight and excess weight, and it's always a theme through any of these cancers is how it can increase risk, but it also increases side effects. And there's kind of a two-way influence there, where the excess weight actually increases those side effects, and those side effects can actually increase your weight. So we have to break that cycle at some point to limit that occurring. If you're overweight, you basically have more insulation, and it's harder to dissipate that heat that we're talking about, to get rid of it out of your core, so it's going to make those hot flashes more significant. And all of these symptoms I'm going to talk about have been shown to improve with about a 10 to 15% weight loss. So we're not talking 50 pounds, we're talking about lower amounts than that can certainly make a huge difference for you. And you'd also, of course, want to incorporate the exercise, which impacts every symptom we've talked about so far in this series. But with hormone changes, we actually see a shift in weight, and many people will recognize that even before they have it occur to them, that older women and older men tend to have more weight around their middle. Part of that is an up to a 30% drop in your metabolic rate, so you simply need less calories, and unless there's some sort of reduction in those calories, you're going to gain weight. We definitely see that apple shape developing even in those whose genetic, potential wasn't that originally. It'll shift into that. And we call that fat that is around the middle, especially that harder fat that's abdominal, visceral adipose tissue. So we have a different name for it. We call it VAT. And that's wound all around the organs inside and really contributes to increasing inflammation and risk of heart disease, stroke, dementia, and unfortunately increases insulin resistance, which is going to be further aggravated if your hot flashes are interrupting your sleep, because if you don't sleep well, you tend to handle your carbohydrates more poorly as well. And one of the things that happens, or what basically happens in insulin resistance, is You aren't able to handle your carbs as well because insulin, when it lands on the wall, on that receptor on the wall of the cell, just is slower sending its messages into the cell to tell it what to do. And when it doesn't clear those blood sugars as rapidly, you end up putting out more insulin to get the job done. And that insulin is a signal of a lot of abundant calories in the environment. And when that happens, historically, we wanted to store those away in case there was a famine later. But it becomes quite the vicious circle for people if we can't intervene in these different areas for them, and that it will cause them to gain weight. Your body is saying, why should I be breaking down my reserves when all the signals are that I have plenty of calories up there and I should be storing them away? And beyond that, we know that abdominal fat is also associated with increased recurrence, which of course is a big concern for anyone with those diagnoses. So the weight management, I just briefly summarized here. There's so many different strategies that people use, but the plate model actually is fairly low calorie, tends to already help control your hunger, for instance, because you're getting fiber there, you're getting protein mixed with carbohydrates. It slows down the emptying out of your stomach a little bit. One of the things that's essential is just using a smaller plate, and you have to get over any training that your mother provided about cleaning your plate, because that's not in your best interest at this point at all. We really are advocating for people to follow that plate model on a somewhat smaller plate, and of course always include exercise to help burn the calories and to maintain the muscle that actually increases the calories that you need in your body. Eating out less often is certainly helpful. People who eat out more than twice a week, it's just so easy to overorder. We're not having to fix it, and it's easy to eat more than we would if we had to fix that at home. We encourage adding a salad or a soup before your meal. It kind of slows you down. You can't eat them very quickly. And it's been shown to cut about 100 calories from what you're eating, as long as you don't feel obligated to finish your plate. If you're eating out, certainly take half home. And then journaling, although that's a bad word in many people's estimation, it's not meant to beat yourself up. It's to identify and fix anything that you find is getting in your way. And we're really just after small, permanent changes that gradually over time you can begin to lose this weight. There's an excellent book out there by Chip and Dan Heath called Switch, which talks about changing habits and making those changes smaller and more reasonable for people to undertake. So as we talked about, if we can limit that insulin resistance and limit the amount of insulin that's floating around and driving that weight gain, the best thing we can do is just drop the amount that we are causing your body to have to deal with at one point. So I often talk about a gentle rain versus a thunderstorm, of carbohydrates. You want to have smaller, more frequent meals and snacks that have that protein, fat, and fiber that slow the emptying out of the stomach, and that avoids that roller coaster of blood sugars where you go really high and then you can fall down rather quickly and just subliminally be looking for carbs again, because your brain likes carbs and it wants to bring your blood sugar back up to normal. So what the protein does is about 20% of the protein will convert to carbohydrate over about 2 hours. So about the time you're coming back down from that high of your blood sugar, it keeps it from bottoming out or causing those lows that are going to send you out looking for carbs again. So overall, we just have less messages going to the cells that are saying that these calories are really abundant and we should be storing them away or using them for growth. That's always the sugar feed the tumor kind of question that we get. So quality sleep, I mentioned, is critical here, and exercise is always critical, feeds into every single thing we recommend for people. I want to move into the soy, we call them the soy wars, or the soy controversies that comes up over and over on a listserv that we have of oncology dietitians. And it's evolved over time. But what we now know is there's significant benefits, and in fact, the only controversy around soy is around breast cancer and whether or not it has the potential of stimulating the estrogen receptors on a breast cancer cell. But what we know is it reduces cardiovascular disease, it's helpful for the immune system, it inhibits growth signals, it inhibits that new blood supply. One of the exciting things that have really come out of this research is about the timing of when soy is probably the most helpful. And it turns out to be during periods of growth. So, that's during development of our sexual organs, our breasts, and that's going to be that adolescent, pre-adolescent time. And if teens in that era are exposed to about 11 grams of soy protein a day, which is not that much, there was a 50% decrease in their risk of developing breast cancer later in their life. And there's a huge study going on now that's using the nurses' health study children, the children of the nurses who were in the original study, to see more quantify that a little bit better. But even in breast cancer, soy is actually very helpful in inhibiting aromatase, so it kind of works with aromatase inhibitors. It encourages some making of better estrogens and of excretion of estrogen, and we'll talk about that, summarize that at the end. And in prostate cancer, we absolutely recommend it because it limits the activity of the enzyme that makes testosterone. So it's been recommended for quite some time in the prostate cancer population and even in prevention for them. So what it's been used actually to limit hot flashes, and it seems to work in some women, but it's a pretty large dose to get a pretty small effect. It really didn't have an enormous impact. It may be that there's a genetic component to that, and people who have certain bacteria in their GI tract who are able to convert it into something called equal, which is only about a quarter of us, seem to have milder symptoms. So if your neighbor has less symptoms than you, it may just be some genetic variation with that as well. But what we recommend, if we kind of sort it out by sex and menopausal status, for men, we recommend 1 to 3 servings a day, and that's been pretty consistent across the board, shows about a 30% reduction, so that's helpful. For women, was initially controversial. So there were people out there on both sides of the fence feeling like it might be beneficial in younger women where that phytoestrogen, that plant estrogen, can actually compete at the estrogen receptor, kind of like you can have 2 cars in the same parking spot. So it was blocking the estrogen being able to land there. But in postmenopausal women where we're trying to get rid of any estrogen-like stimulation, does it provide some signal that wouldn't be a good thing for women in that situation? Tons and tons of studies have been done, and I think, as I'll summarize in a minute, we're pretty much at the point where we feel it's very safe, that it does not increase risk and may, in fact, actually decrease recurrence. The Shanghai study was a recent study that really supported that. And if you look at the whole body of the research, there has not been studies that show that if you eat whole soy foods, edamame, soy milk, tofu, tempeh, those sorts of things, that there's any increase in risk. The only studies that had been questionable were where there were processed soy products used or soy extracts used, or if it was in a test tube of some sort. So overall, we see a reduction in the risk, as you can see here, about 13 to 25% reduction if you look at the highest versus lowest groups. And we can feel pretty safe about recommending that. And the American Cancer Society, the American Institute of Cancer Research, the World Cancer Research Fund, all of them have come out and said that we know that they're safe, and they're actually recommended for young girls because of that age exposure we talked about. But it remains a personal choice, and it's not one that we feel like we have enough data to say everybody should go out and do it. Everyone should be taking in lots of soy every day. There's not that strength of data, but there's definitely enough to say you shouldn't be afraid of it. But if you are, don't do it. Those anxiety-related stress hormones are going to take away any possible benefit for you. So if you're afraid of it, just don't do it. But if you are wanting to include it, do it as soy food. That will be the best benefit for you. And if you go to soyfoods.org or soyfoods.com, there's all kinds of information about soy and what portions are, but I did put some information in here for you as well. What we aren't ready to support at all is to have you taking foods that are fortified with high levels of the particular isoflavones, adenosine and daidzein. Those we aren't comfortable with. Separating that out again, adding it in at pharmacological levels, that's not going to be recommended, I think, at any time. Mark Messina is one of the big researchers in the soy community, and this is a link to a website where he's summarized some of this latest data for you if you want to look into that. What we see in flaxseed is another phytoestrogen that the gut, actually the bacteria in the gut, convert into phytoestrogens, and that conversion is going to be completely eliminated with antibiotics. But again, it may compete at those estrogen receptors. It seemed to work with tamoxifen. It seemed to increase keeping the estrogen bound up on a protein called sex hormone binding globulin. And there's actually been two different studies that were remarkably similar, in a breast cancer study and a prostate cancer study, where they looked at the activity of breast cells at time of biopsy and then again at the time of the surgery, and same with prostate cells, and found that the tumor activity was going in the right direction, the directions we would like, that would make it less aggressive. So there's definitely data that seems to support flaxseed. I would recommend that you start kind of low. We recommend 1 to 2 tablespoons a day as ground flaxseed. And you want to start low because it is a great source of fiber. And if you're not used to that, you'll be spending more time in the bathroom, which is probably not your goal. In terms of fish and providing healthy fats, we find that reduced progression. But we do feel like the oils, the fish oils, the flax oils, the supplements are less effective and less safe. Certainly, flax oil was associated with an increased risk in prostate cancer. So the seed and the fiber in it was the critical piece. Fish oil, on the other hand, has been shown to cut hot flashes perhaps slightly, no great impact in that area. And unless you really can't stand fish, we really encourage you to eat the fish itself rather than taking supplements. Didn't realize this was staged in, so excuse me while I get the whole slide on here. So what we know about supplementation is that it's so important to communicate with your healthcare providers to keep it truly integrative. Integrative means to make whole, so that everyone at both pieces are coming together. And this is an area where a lot of women and men use herbs for the symptoms, and there's over $100 million spent a year in this area. And most people aren't telling their primary care. They may not feel it's of interest or of significance, but there's really no magic bullet. I'm going to go through some of that research. And there's not even agreement between groups of some of these major menopausal symptom groups. One group supports it, another group doesn't really support it. And a lot of the issue has to do with what we call a placebo effect. And this is true for men or women. We end up with people thinking, I'm told this must help me, and just that mind-body connection makes them feel like they see a reduced symptoms. And hot flashes are a little bit subjective, so it's easy to influence that. But the good news is almost everything that you did decreased frequency, but nothing, unfortunately, really seemed to touch the intensity significantly. So that's something to keep in mind when you're looking at all these claims of the different supplements. One I would totally recommend you stay away from is St. John's wort, although it did seem to have some benefits around lowering hot flashes as other antidepressants do. It's not worth the risk, and the other antidepressants work better, and they don't have the issues around St. John's wort, which is that it tends to turn on some enzymes that clear out other drugs rapidly, meaning that you're taking a drug, you expect it to have a certain effect, and it's going to not be hanging around as long as it should, including a number of the cancer drugs. So this is one we really try to push that people are aware of, and they know that it's not something to be picking up off of the health food store shelves. Black cohosh, some trials showed less hot flashes. The trials with cancer patients, not so much. And even though there was some mechanisms that seemed like they would be safe, there was at least one study in animals that showed some more aggressive lung metastases and some toxicity issues. I don't think it works well enough to be recommending this for people, considering some of the concerns that we have. Red clover is another one that people will consider using. It's a precursor of those phytoestrogens that are converted in the gut, somewhat similar to what we're talking about with soy and flax. Really clinically meaningless at the doses that they recommend on the bottles. It does seem to work through some receptors that we don't have as much concern about, and that may actually have some benefit around heart disease. But if you're on Coumadin, you should definitely stay away from it. It tends to increase some bleeding, and there's some impact on those enzymes that metabolize other drugs that we can always be concerned about. Here's a few others that we haven't found any benefit with. Dong Quai is actually considered estrogenic and an anticoagulant. Not a good idea. Evening primrose, the placebo group did better than the treatment group, which is never a good sign. And ginseng, no benefit again over placebo, and possibly estrogenic and also an anticoagulant, and a problem with Coumadin. Progesterone creams, I think they may have kind of faded in terms of popularity. They really don't seem to work. There is an emerging drug that I think we still have to get some more information about. It's not really a drug, it's an over-the-counter Swedish pollens extract that there are some clinical trials that seem to say that it may be beneficial, but everything I've seen hasn't been done in the cancer population, which makes me a little nervous about that. We have to get more data about its safety in the cancer population, I think, before we could move forward and really recommend that. But there have been some conversations on my listserv that people are using it. Environmental issues around hormone balance, I think, are critical. We definitely want to avoid those synthetic estrogens, the hormone replacement therapy that Barbara mentioned. All of those type of estrogens are metabolized into a 4 or a 16 hydroxy form. And by that, estrogen can be hydroxylated at 3 different positions, the 2, the 4, and the 16. And the 2 seems to be protective and decrease your risk. The 4 and the 16 seems to increase your risk of breast cancer. Obviously, prostate cancer, we're not going to want to be doing anything that increases testosterone levels. And then there's all the questions about xenoestrogens, which are foreign estrogens, is basically the root of the word. And we think some of these, again, may have even more impact in periods of growth or in our youth. But what it boils down to is making some reasonable changes, using hard plastic or steel water bottles, certainly not letting a flexible water bottle get really hot and cold and get in your car, and then drinking the water. Glassing, microwaving in glass containers, using hormone-free dairy. I think those are things that people can do without too much stress. But you shouldn't be obsessing about everything being a risk either. And the last slide that I have, if I can get there, is how estrogen balance is achieved through the plate model. I told you I took everything back to the plate model. Here's another example. When you look at some of the things that are on the plate model, you'll see that this mix of things, this mix and balance of foods that are there, make more of the estrogen be formed as that 2-hydroxy form that I talked about that's less problematic and has less incidence of breast cancer. It increases the protein that binds up that estrogen so it's not interacting with the cells. and it actually limits the reabsorption in the GI tract. We actually have something there that likes to recycle estrogen back into circulation. And so some of the things that limit that reabsorption are listed down here as well. And just making less of that estrogen internally, as we talked about with limiting alcohol, limiting weight management. Being overweight just tends to make you make more estrogen internally. Exercise seems to make you make less of that. So all of these factors, as you'll see, affect multiple different areas, and they all fit back into the plate model. And so you can feel pretty comfortable about any issue that you're looking at, that this is how it plays out around estrogen, but there are other benefits around other aspects of cancer as well. So I'm going to turn this back over to, I think, Rhea, did you want it next? And then you turn it over to Steve, or should I?
Yep, we can.
Okay. All right. You have control.
Okay. My name's Steve Musser, and I've been taking hormone therapy now. It's actually a triple hormone blockade, but with Luprod and flutamide and also Proscar. And I've been doing that for the past 24 years. I was diagnosed at age 42, and I'm now 68. And started taking the hormone blockade at age 44. I did have an intermittent therapy. We did use that for a while, and that was good. I felt that was a good thing. It was nice to have that break for about a year and a half, and then we went back on again. As I look at some of the challenges that I faced, very, very practically, the biggest challenge that I faced was the sexual dysfunction, the no libido, the loss of desire. That was a difficult adjustment at first. It was difficult, I think, for men in particular because of the way that we define a man. Our culture, and all you have to do is look at advertisements, look at movies, everything else. Our culture, unfortunately, seems to have a definition that a lot of men adopt, that sexuality really defines who we are, and therefore the more sexual, greater the sexual ability, the greater the man is. And I had to go through a period of really of reevaluating that. I shared it, a couple support groups, a group of us men began talking about it, and it was good. It came out of progress. It took, probably about a year to really make some changes with that. But to realize that a man is much more than his sexual ability. It is also a function of values, a function of courage, selflessness, the family values as a husband, as a father, the things that you can really be feeling good about being a man, which really don't have to do with sexuality. During this time, my wife and I, we talked and talked and talked. It was very, very important. It was hard for me to do that at first. I was totally embarrassed to be able to speak with her about it. But my wife was my primary caregiver, and she wanted to talk about it, and I had to use that word courage if I was going to be a man. And we discussed it, and we discussed more and more and more. And what we both began to do was to redefine what intimacy really meant, because ultimately the sexuality and sexual act is one of a deep intimacy. And so we started to take a look at what those definitions would look like, and what would really meet her needs for intimacy. And I was disbelieving at first when she told me that sometimes that the holding, and as was mentioned earlier, the touch could mean so much. And we do that. We hold each other. We just sometimes spend moments of just holding each other closely, and sometimes for extended periods of time. That was very, very important. I remember during this time, one time, I just couldn't believe that this was really going to work for her. And I said, "That's not what you want." And I remember she said to me, she says, "I want you." And what she meant was she wanted my life, she wanted my attention, she wanted my thoughtfulness, she wanted my relationship. And yeah, it's not been easy. We've had to talk about it. There were just as many adjustments for her as me. But we also learned that, there are ways of touching. Even if I don't have any desire, I certainly can love her, and through touching, and whether that's stimulation, manual stimulation, or whatever, there are ways of experiencing intimacy that's really fresh and actually can be quite meaningful. In fact, I think much deeper than simply those times of intimacy that are related only to the sexual act itself. Also, during this time, as was mentioned, I think prayer and meditation for me, that's the way I dealt with it, and it meant an awful lot. It reduced a lot of the stress. I had hot flashes. In fact, I didn't know what was going on at first. Interestingly enough, they got better over the years, but it certainly was a strong thing. And I found that focusing on diet and clothing really were the two things that made the greatest difference. Caffeine was problematic for me, and so were some spices, not all spices, but some spicy things were, and I had to learn what they were. And so we kept sort of a little, if we joke about it, my wife and I, and say, oh, well, that's one to avoid, because you'd know pretty well after eating it. It didn't take long to get the effect. Clothing also, as was mentioned, was really, really helpful. I used to wear a lot of sweaters, and I soon realized, and they were pullover sweaters, I soon realized that that's not a smart thing to do. So I got out of some of that, because sometimes you want to be able to take it off easily and unobtrusively. If you're in a meeting or you're in social context, you want to be able to not make a show out of it. But so those things really helped. And also, as somebody was saying, how sometimes the heat flashes could be discouraging because it reminds people of their cancer. For me, it turned out to be just the opposite. Every time I got a hot flash, it was I used it to say, wow, this is good, because it's a reminder that I'm managing my cancer, that I'm managing it, and that made a great deal of change and help. I have some gynecomastia. To be very honest, I just dealt with it with loose-fitting clothes. It's something that if I look at myself straight on in the mirror, I really don't see it very often. Side profiles, you can see some of that, but I didn't go the route. I did find some pain in the beginning, where the nipples would become very, very hard and very, very sensitive. Even just a shirt rubbing on it, it was something very new. But that passed too after a while, and as I said, I just wear loose clothes. And finally, the fatigue. I did experience that, and also I don't know if I know you talk about bone loss, but I felt I actually experienced some muscle loss too. So that was remedied rather easily though with exercise. I bought a very inexpensive treadmill, and it didn't have all the bells and whistles on it because I wasn't going to run. I was simply going to walk at a pretty decent pace, and that seemed to change everything. All of a sudden, I noticed when we went on vacation, I was able to keep up with my wife. We could take long walks together, and just had a very good experience with that. Exercise was a definite plus, and I was not a person who exercised outside of what I did out of normal work. So the exercising was something I began to do very deliberately, very intentionally, and it made a huge difference. And just one other thing. I did have a little bit of problems with sleep. In fact, that started more recently. More recently being like 5 years ago. And what I found was the most effective, and again, I'm just reiterating what was probably already shared, but what I found to be most effective was reading before bed. I had to be careful. If I watched some type of a sporting event or something, I get really excited. Well, that obviously kept me up for much later. It was hard to come back down after I was excited. But I found that reading was very, very relaxing for me. And novels. If I read something intellectual or something that was going to be something I was going to try to remember, that was going to be a problem because it kept my mind going, and I get my mind racing. But if I just read something easy, it was a good way to prepare for that. So that's my experience. And I guess, okay, Rita.
Yep. Thank you, Steve. Sharon?
Okay. Well, I've always been a fairly healthy and active person, seldom sick, and took no medications except for vitamins. But since having cancer, the therapy treatments have caused health concerns that I can only assume I probably would not have had or faced naturally. I've had 3 journeys with cancer. My first at age 43. It was breast cancer, and my cancer was estrogen positive, but since I also have a history and a tendency for blood clotting, the oncologist determined that the follow-up hormone therapy at that time with tamoxifen was not an option for me. I thought I was cancer-free, but as years passed, in 2009, 12 years later, I was diagnosed with breast cancer again. It was a different strain of cancer, this time in the other breast, and that was a good thing because it wasn't metastasized cells, but again, it was 60% invasive cancer and estrogen positive. The oncologist decided that we really need to find hormone therapy that would work for me. After 4 months, however, on something called Arimidex, my liver functions showed considerable damage. The therapy was discontinued until my liver functions were again established. Then we switched to another hormone therapy called Femera. This also affected my liver functions, and we just couldn't risk it anymore. So we stopped both the hormone therapy and the blood thinner that I was taking. However, less than 3 years later, a nodule in my chest seemed to be increasing in size. The surgery showed again a tumor, this time growing into the chest wall, since I had no breast tissue. And again, it was invasive cancer. Both my chemical and radiation oncologists agreed that treatment needed to be aggressive. So after a 38-day course of radiation treatments, I was prescribed a full 5-year course of hormone therapy. The chemotherapy was not advised at this time because it would have only increased my recurrence chances only 13%. It wasn't effective. So, of course, I wasn't going to do that again. The estrogen blocker needed to be found that was something that my body could tolerate. So we tried something newer called Aromacin or Exemestane. And so far, after 19 months, my liver has not shown any significant damage. My functions seem to be pretty good. This is great news, and the only thing is again, the loss of the less estrogen means bone loss. So for this, I simply take multiple vitamins and extra calcium plus vitamin D twice a day. The hormone therapies tend to cause the clotting in the blood. Therefore, I need to be on a blood thinner because, again, I have a tendency for blood clotting for at least the duration of my treatment. Unfortunately, the blood thinners carry their own list of side effects, like arthritis, so I'm getting a double whammy as far as the side effects are concerned. These arthritic symptoms, I would say, are probably the worst category of symptoms that I experience. I work a very full, some mostly overtime schedule each week, and I need to be always on the go. Because of the blood thinner, I cannot take any kind of NSAIDs, so I'm pretty much on my own to cope. I also personally refuse to take any kind of narcotics or narcotic-like drugs. Natural remedies I've kind of added to my diet. It was recommended by some friends of mine to try turmeric root, and added blueberries, increased use of garlic. They seem to offer some slight relief. Other spices, I heard others talk about spices tonight, and foods, some like ginger or dark or tart cherry juice, warrant research into their healing or soothing effects. Plus, it's kind of fun to read about them and even grow your own herbs. Fatigue, I'm sorry, I don't take my own advice. You really need to get plenty of rest and sleep, but again, I'm way too busy, and I really have to work on that myself. My vision changes. The ophthalmologist cannot determine if it's really from my diminishing vision is from a side effect or something she called aging. So I don't know. Who wants to hear about that? The dry skin, I promised myself that extra minute after every shower to apply lotion, so it's just become part of my daily routine. Another extremely annoying side effect are the foot and leg cramps that I get in the evening and during the night. Again, the turmeric was recommended by several friends and supported by my primary care physician, but I have not tried it long enough to tell you whether I really think it's helping, but I do believe it has had some effect. I get up and I walk around and I stretch. Movement is my best relief, but again, there has to be a balance. Sometimes too much exercise all at once causes that post-workout pain that disables me for a couple days. At home, I try to soak in, we call it a therapy spa, but we have a hot tub, and I try to soak in it at least twice a week, and we take walks. It's great exercise for all of us, and it's free. If someone is around, just ask for that shoulder, foot, or leg rub. I'm very blessed with a husband who rubs my feet and ankles in the evening. People want to help and don't always know what to do. So if we let them know what we need, this can be really effective. And touch has been talked about a lot this evening. At work, I invested in an elevating desk so I can stand and move my legs most of the day. When I sit, I use a back support and a low footstool to elevate my feet. When I instruct my water aerobics class, I instruct from the water and reap the benefits of moving through that rigorous workout without the impact on my joints. I feel great for the rest of the day, and I highly recommend water exercise as frequently as possible for everyone who can. My husband and I used to be very active, and when our children left home, we thought, we're going to rekindle our enjoyment of racquetball and be those active, hip grandparents. But health concerns changed both our lives. Instead of lamenting, however, over what we used to be able to do, we found enjoyment in new endeavors like kayaking on the more peaceful water sources, and we also rebuild our bicycles and ride the rail trails. At least the rail trails are fairly level pathways, and it's through safe and beautiful terrain. It's somewhat comforting to hear and talk to other people who say they're experiencing similar symptoms. And when the doctors explain that these are normal, I guess that makes you feel a little better. However, discomfort is still discomfort, and we have to own our own pain. So I just recommend that keep a sense of humor about your new normal. We've adopted this phrase, and it seems our new normal seems to go in phases and change often, but we may snap, crackle, and pop when we stand up from a chair, but slow and steady wins the race. I will continue to pray moment by moment for relief and trust in the hope and peace our Lord has placed in my heart, but remember that God's in control, and with His strength we can work through all of these trials and support each other. I just thank you for this opportunity for sharing.
Great. Thank you, Sharon. So at this point, I would like to open up the presentation to the audience. We've received some questions throughout the presentation, but if you would like to ask some additional questions, again, please feel free to do so through the Q&A box. So we have one question here. So are Colleen or Barb, are there any specific moisturizers for the vaginal area, either over the counter or by prescription only, that you would recommend?
Yeah, sure. This is Barb. The one that people talk about being helpful the most is Replens. All the moisturizers are over the counter. You don't have to get anything. And actually, prescription-wise, most of the suppositories or creams that you would use would be estrogen, and you're going to most likely need to stay away from that. I think it is worth a conversation with your healthcare provider, though. But using something like Replens or and then Astroglide's another one that I've heard people like, or KY jelly as a lubricant.
Great, thank you. Colleen, we have a question here about soy. It says, my breast cancer was estrogen grown, I believe HER2 positive. My oncologist has me not take any soy supplements at all. So soy isn't a good option for me. Any thoughts on that and some of the research that's out there? Oh, Colleen?
Sorry, I was muted. Okay. Now I am. Now I'm not. Can you hear me now?
Yep, I
Hello?
can hear.
Okay, sorry. So I think we all learn certain things during our training that make an impression on us, and sometimes it's hard to change that impression or to advocate for something that we consider having been a risk at one point. A lot of healthcare providers will prefer to stay on the side of absolutely, no risk. I personally, this is what I tell my patients, I personally would take it. I wouldn't have any concern about taking it. But if you have concerns and you have anxieties about taking it, again, those stress hormones are going to get rid of any benefit from it. But I guess I would say I would not agree with that position based on current evidence and based on what the major organizations are recommending at this point.
Great, thank you. And I would also just add to that, if you have any questions about any sort of, supplements or soy or anything like that, that you should speak with your healthcare provider if you have any questions about that. Okay, so our next question here, it says, if you're postmenopausal, why do you have to take Arimidex or estrogen reducer? If you aren't producing estrogen, how can this pill really stop something you aren't supposed to be producing? Barb, any insights on this?
Yeah, during menopause, your body greatly reduces the amount of estrogen that you're producing, but your body does continue to produce some estrogen. And estrogen is not just produced in the ovaries, it's also produced in fat tissue, so it's actually produced in multiple places in your body. So while the normal mechanisms for producing estrogen decrease, you still have estrogen in your body. And that's why you want to continue to take the anti-estrogen drugs.
Okay, great. Thank you. We have another question here. It says, and if you need me to repeat the question, just let me know. It says, if a predict type chart shows that you have a probability 75%.
Hey, Rhea, sorry, go ahead.
Go ahead. With no therapy, and then 77% survival with aromatase inhibitor. Is that 2% worth the side effects, risk versus rewards, in someone who's a 79-year-old, otherwise healthy woman?
That is such a personal choice. I'm sorry, this is Barb. People will ask their nurses and physicians and all that what they would do in that situation. That is such a personal choice. It would be very easy for me to say, oh, I would or I wouldn't. But, gosh, I think it's something you really need to talk in more depth with your healthcare provider about. You may want to talk to some other women who have made the decision either to continue or not. I will tell you that there is an increased discussion about whether we're over-treating, which I wouldn't say we necessarily are, but I think it's something that needs to be a very thoughtful decision. It's also probably not a decision you have to rush into.
Okay. Thank you. So we have a question here. It says, my oncologist recommends at least 7 years, possibly increasing to 10 on Arimidex. Will they actually say that I need to take it for the rest of my life? Again, this might be a question that they would need to speak more closely with their healthcare team on. But if you had any additional thoughts.
Again, the evidence is changing over time. There is some evidence that says that 5 years, right now 5 years is pretty much the standard, but there is evidence that shows that 10 years may be better, but I think that it's still not definitive. So, unfortunately, healthcare and oncology care in particular at this moment in time is not an exact science. It's not cut and dry. And so decisions are being made based on the best available evidence. So, the answer changes.
Okay. Great. So we are actually at 8 o'clock p.m. Eastern Time, so that is all the time we have for questions. If you have any additional ones or would like for us to answer any questions that you do have, please feel free to contact, again, our helpline, or you can use the chat function of our helpline as well. So next week we will be hosting the final episode of our 5-part series, which will be on coping with nausea and vomiting. If you would like to register for that event, and if you have not already, please feel free to do that on our website. And listed on this slide are just a couple of resources for more information. So if you'd like some more information, please feel free to visit any of these links listed here. So at this time, I'd like to thank our wonderful speakers, Barbara, Colleen, Steve, and Sharon for contributing their time and sharing this important information with us. I'd like to thank our program supporters, Amgen, Astellas, Lilly, and Tesaro as well. So at this time, you will be redirected to our post-webinar survey. It's a brief survey, and we appreciate any feedback that you may have for us. Thank you so much, and I hope you all have a great night.